Hello, and my name is Tamala Hamilton Walker, and today I'm going to explain the process of liposuction. As many of you know, we try different diets to lose weight, and we exercise to try to tone the fat that remains after we lose weight. But that's just something that we can't do in exercising, walking, or whatever the case may be. But think about this for a minute. We get invited to a formal ball or even a wedding that is so special to us. And we have this beautiful formal dress or this tuxedo in our closet. We want to wear it to this type of event, but it just don't look right when we try it on. We continue to diet, we continue to exercise, but we seem just cannot get rid of that excessive fat. So what do? We sit around and we think. I have 4 months to plan and get ready for this occasion, something I'm looking forward to. I continue to sit there watching TV when I see this commercial comes on about liposuction. It tells us that it cures most areas such as the liposuction itself, tummy tucks, trunk tucks, arm lipo, and whatever else that case may be. Therefore, we get the telephone book to see can we locate one in the area that we live. So we look up on the cosmetic surgeries. Sound familiar? As we look, we find a physician that catch our eye. We pick up the phone and we call. We schedule for a consult. So I will schedule for that appointment. I will go in, sit down, and talk to the surgeon. I also have these questions that should be answered at this particular time to prepare me if I really want to have this particular procedure done. So the first step will be preparation. Once again, preparation is the consult, the surgeon, and the questions that you need answered. Preparation is also done briefly because you have to have yourself on a time frame in order to get your body where it needs to be for this particular surgery. So therefore, the first step is preparation, which is you and the doctor sit down and talk. You discuss about the anesthesia that will be given. If you have a stay at the hospital, if you need someone to bring you home. Also, it talks about different medications you shouldn't take before the procedure and at least 2 weeks prior to this procedure. Normally, this procedure is done in the morning time, and mine was scheduled for 6 o'clock that morning. So I was prepared. I had to fast 12 hours prior to my surgery. No tobacco usage of any type because it can cause tissue loss in the body. The anesthesia is something that you will be getting either through a shot, IV, or whatever the case may be. It only determines according to your procedure itself. The second step of the procedure is the procedure. I'm sorry. This step is allowed in all liposuction methods and things that have been done before the surgery. Once again, you will sit down with the surgeon, and you and he both must agree upon the area or areas of the reconstruction that you want to have done to see that special outcome. A consent form will be signed the day of the surgery, and also your anesthesia will be given. They also give you antibiotics before the surgery and antibiotic after the surgery to prevent any type of infections that may occur. The surgeon will then mark the target area or areas of the surgery. Therefore, you will stand up. He will take the before picture, and he will mark those areas that he's going to be doing the liposuction on. Some of the liposuction is very simple. Is lipo itself. That's where the before picture shows she have a stomach and the little fatty waist, but then over here is more flatter, but she's still swollen. So once he target and you prefer the surgery, your anesthesia will be given at least 10 minutes prior to the surgery because it don't take long to numb you. Also, it will be hooked up to a monitor to check for blood pressure, heart rate, blood oxygen due to the anesthesia. Our incisions can be as small as a quarter to about a third of an inch long, and some is a larger due to the depends on the type or amount of fat that you have. The small incisions are always left open so that the excessive fluid can drain so that the infection will not occur. But they will place surgical tape over those incisions. Other procedures will have stitches or even staples. Last but not least, when you wake up, you're more sore and they have to explain more things to you. That's where your compression garment come in. The final step is the recovery. After this surgery, the patient will be able to go home, and within 2 days or even up to 2 weeks, you're able to go back to work. The garment that I was discussing is easily to be removed by the patient and must be worn for 2 to 6 weeks. Non-absorbent sutures are removed after 5 to 10 days after this procedure. Pain is controlled by prescription drugs or even over-the-counter medication. You will have some bruising that will fade within a couple of days. Swelling will subside within 2 to 3 months, and the numbness may last up to several days or several weeks. Normal activity can be resumed anywhere from several days to several weeks depending on the procedure. The final result will be evidence anywhere from 1 to 6 months. In conclusion, the main purpose of this liposuction is to reshape your body and feel good about yourself, but not to reduce the body fat or weight. Some just think that liposuction can look and feel good about you. So, since you heard my speech and heard about the procedure, would you try it? I sure did. Thank you.